I shall now introduce our guest, Professor Helen Minnis. Helen and I have known each other since we were both doctors in training, me in public health, Helen in psychiatry, but I think we both had an interest in each other's topic. And Helen now is an internationally renowned researcher in children's and young people's mental health at the University of Glasgow, and she's built up a huge body of work which she will be able to refer to in her talk. The wonderful thing about Helen is, although she's a fantastic researcher, her heart is in having practical solutions, practical interventions, things that will really make a difference to children, to young people, and to their families. And she's very clear that we should be using interventions, treatments, services that are, where possible, evidence-based. And that's why she's so good at the job that she does. So I'm going to pass on to her now, and she's going to speak about ADHD and trauma, preventing negative cycles, and the thinking behind that title will become clearer as she goes through her talk.
Thank you so much, Linda. Yes, it's probably quite good if Linda and I don't think too deeply about how long we've known each other. But I'm really delighted to be here with you. And I do hope that you will ask questions and make comments at the end, because I think that just makes the whole thing so much more interesting. So I've been asked to talk about ADHD and trauma, preventing negative cycles in a digital age, because I think this series is really thinking about the fact that we are in 2025 and we're living in a digital world. Some of us didn't grow up in that world, and so we're all kind of trying to grapple with it. But ADHD is also something that has increasingly become concerning for all of us. Diagnoses, rates of diagnosis are increasing. It's hitting the headlines. This is just some of the kinds of things that have been being said about ADHD and autism as well. What causes it? Why are diagnoses soaring? There's concern about whether we're kind of diagnosing ourselves or our children on the internet. Is overdiagnosis something that we should be worried about? So we'll get into all of that. But first of all, what is ADHD? So ADHD is attention deficit and hyperactivity disorder. And in some ways, it's a very simple thing. It's made up of hyperactivity, impulsivity, and poor concentration. And we'll talk quite a bit about all of those as we go along. You can actually diagnose ADD, so attention deficit disorder, with just the impulsivity and the poor concentration. So it's become more and more recognised that children who are not, or adults who are not hyperactive, but who still are impulsive, who might run into the road without stopping and thinking, and who might be kind of distracted by things going on outside the window at school, in many ways are actually even more impaired often than children who are hyperactive, because we tend to notice the hyperactive children. ADHD is very common and it's very treatable. So we've known about it for many, many decades, and we've known how to treat ADHD for many, many decades. If you look at the NICE guidelines, the recommendation for ADHD is psychological and family-based interventions to really focus on children's behaviours and try and help parents cope with those, and or stimulant medication. And stimulant medication often people really worry about, but actually it's been around for decades and it's actually one of the safest medications. One of the things about it is it doesn't last in the bloodstream for very long. So if it's not working, you soon know. Many successful people have ADHD. So another thing that's been really recognised more and more is that those symptoms of hyperactivity, impulsivity and poor concentration don't necessarily cause problems. So this is just one of the people that has been kind of out and proud about ADHD now for some time. That's Emma Watson, who played Hermione Granger. And I think Emma Watson is pretty much just as brainy as her character, the character that she played. I mean, she's been to Yale, she's been to Oxford, she's done extremely well. The latest I read about her was she was on the boating team, I think, Then incredible leading athletes as well. Actors. Will Smith's an interesting one because, certainly I think from his recent behaviour, he's often got some impulsivity. But these are very successful people. And I've been pretty successful myself. I'm a professor of child and adolescent psychiatry. I got a diagnosis of ADHD at the age of 54 a few years ago. And it was actually really, really funny because I went along with my husband to see a young psychiatrist. You get to my age and psychiatrists and policemen start to look young. And I said to him, look, I'm not an expert in adult ADHD, so, just treat me as if I know nothing about this. And we got about 10 minutes in and he said, look, Professor Minnis, you've got to have a bit of professional... Oh, don't worry, no, honestly, a bit of professional respect. If you think you've got ADHD, you probably do. And we all burst out laughing. Yeah, no problem at all. But then the person who really laughed was my mother. She was in her 80s at the time. And when I told her that I'd just got a diagnosis of ADHD, she was just like, yeah, I could have told you that. I could have told you that when you were 4, to be honest. All the videos of me as a blur or hanging off the bars of the swings rather than being on the swings itself. So the full works. But of course, they didn't diagnose ADHD in girls, especially not girls who are actually doing reasonably well at that age. So, is there really an overdiagnosis epidemic? Actually, and a group of us have been thinking very carefully about this, we've been writing a paper about it, underdiagnosis is a much bigger problem in the UK. I think there are other parts of the world, like America, where perhaps there's been overdiagnosis, but in the UK, actually, particularly in girls, particularly in ethnic minority children and adults, and in adults generally, there's underdiagnosis, particularly in the elderly. This was just an interesting paper. I can circulate the slides after if any of you are interested in going and looking at the research evidence. But this was a fairly recent paper, 2018, I think, just kind of weighing up what are the benefits of treating, identifying and treating ADHD in adults. And one of the things that they've said, and there's a huge body of research showing this, is that untreated ADHD is associated with multiple adverse outcomes, including increased mortality, but also drug misuse, criminal activity, homelessness, all sorts of things. I do apologise. I have got an absolutely raging cold, so I just hope you can hear me. I'm sounding more and more like Tom Jones. Anyway, I'm not going to try and sing. But one potential adverse outcome is child maltreatment, and I'm going to talk you through this because this is something that has gradually been a kind of dawning for us and our team over the last few years, the links between ADHD and childhood maltreatment. Children who have ADHD are also more likely than their peers who don't have ADHD to experience abuse and neglect. And we've been looking at what causes what. This is actually an ex-student of mine, Evie Bally. She's now a lecturer in psychology at Caledonian, but she finished her PhD last year. And her first paper was doing a systematic review of the literature, looking at causality, looking at what causes what. Is there evidence of a causal link between ADHD and child maltreatment? And if so, does ADHD cause maltreatment? Or does maltreatment cause ADHD? Actually, what she found was that we don't know the answer. And it's very difficult to be certain. On balance, we think it's probably quite rare that maltreatment causes ADHD. There are certain instances. So, for example, children who have experienced a shaking injury, for example, to the brain, where there's an actual injury to the frontal lobes, potentially, could end up with ADHD where it wasn't there in the family. Because ADHD is known to be very heritable. It tends to run in families. If you're a child with ADHD, you tend to have an auntie or a mum or a gran with ADHD or a granddad. Fetal alcohol spectrum disorder can be associated with ADHD, for example. It may be that causes ADHD, or it may be that we know that in adults, older children and adults who are impulsive are more likely to drink. So we're still not certain of the direction of causality there. So there are some clues, and we just recently published this paper where a genetic risk for ADHD. So you can basically look at your DNA, and you can look at all of the little genetic risks, sometimes hundreds of little genetic risks that add up to what we call a polygenic risk score. And there's been lots of research showing that if you've got a high polygenic risk on this particular score, you're more likely to have ADHD. And if you've got a high polygenic risk for ADHD, you've actually got, this was in the Danish population, a much higher absolute risk in your lifestyle, in your lifespan, across your life of being abused or neglected. Just want to remind you something about risk, though. That doesn't mean that people who have ADHD will be abused and neglected. Nothing like that. The overwhelming majority of people with ADHD don't ever experience abuse or neglect. It's just you've got to have a bit of an increased risk. It's a little bit like the majority of people who are a bit overweight are not going to die of a heart attack in their 40s. Thank God. But if you are overweight, you're at higher risk of your skinny friends of dying of a heart attack in your 40s. So it's that kind of thing. So I want to talk for a moment about adverse childhood experience. So I suspect this audience will have done a lot of thinking about what we call ACEs, because ACEs include abuse and neglect. So let's just focus on ACEs for a second. So on this side of the slide, you've got the abuse and neglect that we recognise. So physical, emotional, or sexual abuse, physical and emotional neglect. And on the other side, we have what Felitti and colleagues, so this research is like 25 years old now, Vincent Felitti and colleagues developed the scale of the 10 ACEs. And household dysfunction, many of the household dysfunctions are much more common. So having a parent with a mental illness, having a parent who was treated violently by their spouse, parent involved in substance misuse. It's quite rare actually to have a parent who was in prison at a population level, but divorce is very common. So some of these are really quite common. And I think something like 40% of the general population have had one ACE. So this is, normal. But it's once these start to be cumulative. So if you have sort of 4, 5, 6, 7, 8, 9 ACEs, then your risk really starts to increase of physical and mental health problems. So what they showed was that there are what we call dose-response curves, relationships between the number of adversities that you have in childhood and your odds, your chances of negative outcomes. This was kind of old news that when this particular graph was shown sort of 25 years ago. Hi, please do come in. I feel really sorry for the folk that there's really good reasons. This is not necessarily that easy a place to get to, so don't feel bad about being a few minutes late. But I feel as if we've created a naughty step. I'm so sorry. It really wasn't meant to be like that. You're fine. Anyway, we had actually known since the 1970s that adverse childhood experiences, so basically difficult things happening in childhood, like your mother dying before the ages of 7, for example, or being abused and neglected, was associated with an increased risk of depression in adulthood. So this was kind of old news even 25 years ago, but this was new news. So what the Felitti and co studies showed was that if you've got 7 or 8 of these adverse childhood experiences, you're actually more than 3 times the risk of developing a heart attack or a stroke in adulthood, which was a big surprise, and that really woke up the scientific and medical communities. So at a population level, you can think about the load that children are carrying. So the bigger their load, the bigger the risk. And this, of course, is a poor wee soul from Victorian or pre-Victorian times. And I was just talking to Linda over lunch. I think, unfortunately, the lives of our children are catapulting back to that. We're really sliding back towards Victorian values, but that's a whole other talk. Anyway, I noticed in my clinical work as a child and adolescent psychiatrist a few years ago, 12 years ago now, that people who'd been maltreated at whatever age, so if they'd experienced abuse and neglect in childhood, they tended to have, if they had mental health problems, they tended to have complex overlapping problems. But the really confusing thing was some of them didn't have any problems at all. And this is something that you see as a researcher that you maybe don't see as a clinician. In our research studies, we do studies with children who, for example, just finished a study of 488 children in foster care under the age of 5. 40% of them had a mental health problem. What that means is that 60% of them didn't have a mental health problem. So even though in the general population of babies to 5-year-olds, about 7% would have a mental health problem. So that's a really high rate. 40% is a really high rate. Still, most of them don't have a mental health problem. So that's really interesting and important to remember. Just because you've been abused and neglected doesn't mean you're going to have a mental health problem. But that was the really strange conundrum. If people did have a mental health problem, they tended to have more than one. So what was going on? And I wasn't sure whether I was just being sent along the complex cases. So this might just be a bias, but it seemed to be that the bigger the load, the bigger the risk. But not all people who have a big ACE load have problems at all. So what is going on? You got the problems, you get complex problems, but some people don't. So we wanted to look at that at a population level. God, I hate it when I tell you what's on my slides before I actually fast forward to the slide. But anyway, so we'd also noticed that in and amongst those overlapping problems, a lot of the problems were neurodevelopmental. So things like ADHD, autism. I actually did a study a few years ago where we were looking for the kinds of problems that you only see in children that have been abused and neglected. You've probably heard of attachment disorders. We're looking for attachment disorders in the population of North Glasgow. I'm a proud resident of North Glasgow, but actually most of North Glasgow is quite materially deprived. Springburn, Possil, Casey, that. In that big population, we found a few children at the age of 6 or 7 who had these abuse and neglect related problems, and they all also had other overlapping problems. And there was a wee child that had a tic disorder. And I had assumed that these problems were caused by abuse and neglect. But I thought, how can tics be caused by abuse and neglect? So that really got us thinking. So we wanted to look at neurodevelopmental conditions in people who've been abused and neglected. And we were able to get access to a really big study called the Child and Adolescent Twin Study of Sweden, called CATS. And I mean, it's absolutely massive. Basically, they keep on recruiting all of the twins that are born in Sweden, whether they're identical or non-identical. So what the CATS team had asked at the age of 9 was about symptoms of, or traits of ADHD, autism, tic disorders, and intellectual disabilities or learning disabilities. So they had already done that when children were aged 9. And they'd also asked about whether children had experienced abuse and neglect. And we were asking, are abused and neglected children in the population more likely to have multiple neurodevelopmental conditions, which is what I'd noticed clinically. And the answer was yes. But it was an even bigger yes than I'd expected. We found that children who'd experienced abuse and neglect were actually more than 6 times as likely as their non-abused and neglected peers to have neurodevelopmental conditions. And once you got, there was a smallish group in the population that had 3 or more of those types of symptoms, and they were nearly 10 times as likely to have been abused or neglected. So I had always assumed that abuse and neglect was causing this. So we wanted to look at that. The thing about the twin methodology is identical twins share 100% of their genetics. Non-identical twins share 50%. So you can kind of model the degree to which something's genetic and how much it's environmental based on the degree. We talk about concordance, how similar identical twins are to each other and how similar non-identical twins are to each other. If you're actually interested in the methodology, I'm not going to go through that here. There's actually a little YouTube It's Helen Minnis, Rebecca Lacey. No, Helen Minnis and Lisa Dinkler. Sorry, Lisa Dinkler is the lead author for this. If you're interested, you can just look that up on YouTube and you'll see me asking Lisa some stupid questions about the methodology. But so basically we asked, does abuse and neglect cause this complexity, this neurodevelopmental load? And the answer was no. Abuse and neglect didn't cause the complexity. Actually, what we would call genetically sensitive study, what it showed was that there were additional genetic factors leading to both the abuse and neglect and to this neurodevelopmental complexity. We were really surprised. Back in the day, this study is 8 years old now, and I was actually on Skype, that's what we used to use 8 years ago, with my colleagues in Sweden, and also my colleague Ruchika Gajwani. And we were just both in different rooms, so we were both on Skype, and I could see Ruchika was like this, she was like... And then I noticed that my mouth was also O-shaped. I was equally shocked. So we went away for a bank holiday weekend to try and work out what was going on. And we don't know for definite from this study, but we suspect that this might be neurodevelopmental conditions running in the family. So the genetic factors are probably neurodevelopmental conditions in the parents of these children. So in other words, it's the kind of heritable factor. So we talk about the intergenerational transmission of abuse and neglect, but what we're thinking about a lot now is the intergenerational transmission of neurodevelopmental conditions like ADHD. So could neurodevelopmental conditions like ADHD actually increase your risk of abuse and neglect? And this is a very kind of challenging and controversial thing. And so I think the best way to describe it is to use a personal story, because I don't want to talk judgmentally about anyone else but myself. But I was a horrible little girl. Oh no, I don't think I was horrible. I think I was lovely as well. But my parents used to jokingly talk about what a nightmare baby I was. I was the kind of baby that at 18 months I was just screaming the place down all night, wanted to play. They were exhausted. They went to their GP. They were lucky. They had two-parent family. They had enough money. They had grandparents that were supportive. They went to their GP and their GP prescribed sodium amytal. Now, you wouldn't even use sodium amytal in adults now. It's like a horse tranquilizer. And they used to tell this funny story with their pals that they went to the pharmacy. It's one of the old-fashioned pharmacies with the counter and the phone behind the counter. And the pharmacist said, in his white coat, he said, "You can't give this dose of sodium amytal to an 18-month-old baby." And they said, "Well, phone the GP." So they phoned the GP. They could hear both sides of the conversation. And, "You can't give this to a baby." And the GP said, "You don't know this baby." So they tried to give me it, and of course it just had a paradoxical effect, which sometimes these things do with babies with ADHD, as we know now. I didn't know that then. And it just made me kind of even more obnoxious from all intents and purposes. So what they did was they took the sodium amytal. So my mum would take it on a Monday night, my dad would take it on a Tuesday, my mum on a Wednesday, my dad on a Thursday, so they get a sleep. And I mean, I tell that. They used to tell it as a funny story, but actually, thank goodness they didn't abuse and neglect me. And, we've done a lot of work co-producing services with parents who are struggling. And one of the things parents have told us is that sometimes they've had to lock themselves in the bathroom. I've actually got a quote from a mum who said, "I had 3 children, but I neglected that wee one because I just couldn't cope with his behaviour." So you can see how actually, if there are other things going on, and if families don't have the right support, there could be a toxic situation could arise. Wasn't I lucky? So just reminding you of the traits, the hyperactivity, poor concentration. Impulsivity often includes temper tantrums. And actually, temper tantrums they're not officially part of the symptomatology of ADHD in the psychiatric classification systems. And that's just because back in the day, a committee decided it was part of something else. But actually, if you look at all the epidemiology, if you look at all the studies that have been done across the world, children with temper tantrums are most likely to have ADHD. And if you think about it, it makes sense. It's kind of like the psychological equivalent of running into the road without stopping to look. And we know that unfortunately, adolescents and adults, fully grown beings with temper tantrums, end up getting put in prison. And if you can't stop yourself saying what's on your mind in the pub and somebody punches you. So I think it's really important that we recognise that temper tantrums are part of ADHD. And that we must remember also that parents may also have these heritable problems with learning, impulse control, and problems with language or social understanding, for example. Ironically, though, there is actually evidence that parents who are neurodivergent are often even better parents of neurodivergent children. Often they're more tolerant. They just kind of go with the flow. I'll give you an example. I've got a dear colleague who's autistic. He's a child psychiatrist, very open about his autism. And he's got a little girl who's also autistic. And she said to him when she was about 7, she said, "Daddy, I can't stand looking people in the eye. I just can't stand it. It makes me feel sick." And he said, "Listen, honey, I'm the same. I'll give you a trick. Don't look at their eyes. Look between their eyebrows." And so that's what he does. That's what she does. And then nobody can tell. Only an autistic dad would have had the insight to help her in that way. So actually, being neurodivergent as a parent can make you a better parent of a neurodivergent child. So why do we end up sometimes with these vicious cycles? My hunch is it's because you end up with other problems in the mix. Problems like poverty, or maybe a very, very unsupportive father-in-law, or you've got insecure housing, you get council tax debt. Any of these things could make life additionally stressful. And so you could be a parent, you could be the best parent with ADHD if you're a child with ADHD, but once you get stressed, it's very hard to deal with your own impulse control, or to tolerate your child's behaviour. So Ruchika, this is my colleague Ruchika Gajwani, do a lot of work together. She's a clinical psychologist. And interestingly, she grew up in India, where trauma is almost universal, just keeping an eye on the time. So she's got a really interesting attitude to trauma, where, trauma in the population is actually a normal experience. We somehow in our societies, in our Western societies, we've started thinking that trauma is somehow unusual and abnormal. Actually, we're physiologically designed to cope with famine and pestilence, and everything in between, which really does explain why many abused, neglected children or adults are fine. But we came up with this model that we called double jeopardy, because if people who are neurodivergent also have an experience of abuse and neglect, then we have a hunch that they are more likely to then develop mental illness, particularly severe mental illness like psychosis or whatever later in life. So we looked at this back in the CAT study, so the child and adolescent twin study. We didn't use it as a twin study this time. We used it just as a big population study. And Ruchika led on this study, and we looked at children aged 9 who had experience of both abuse and neglect, and who were also neurodivergent. And then looked at how they were doing at the age of 15. And what Ruchika found was that they were twice the risk of developing mania at the age of 15. We picked mania because mania is a symptom of bipolar disorder, or manic depressive disorder, which you might have heard it called that. And mania is something that generally doesn't emerge until adolescence or adulthood. So we picked mania because it's something that you wouldn't expect to see in childhood. So basically doubled the risk. So actually we were right. We haven't published this yet, but we're finding something similar for heart disease as well, actually. I've got a colleague that's just been looking at this in big Danish population cohorts. So how might double jeopardy actually work in practice? Why do these two risk factors kind of work together like this? So let's just get back to thinking about children. Imagine you've got a child, an autistic child, who maybe finds certain noises, textures, or smells intolerable, really intolerable. And this, you can imagine this causes problems because, do you know, I heard I've got a colleague actually who's got an autistic daughter who liked cheese and liked butter and liked bread, but could not tolerate them in a sandwich because there was something slimy, it's the texture. Absolutely intolerable. But the amount of arguments and until it was understood that there was actually a texture problem and that she literally couldn't tolerate it, there were just endless arguments about, like, how come you can eat bread and you can eat butter and you can eat cheese, but you can't put them in a sandwich? That's ridiculous, you know. In the classroom, children with autistic children who've got sensory sensitivities can find the classroom overwhelming, and that can lead to negative behaviour. Sometimes just detecting that and actually perhaps providing ear guards for the child can make all the difference. So understanding the child can make all the difference. What about if you're a child that has repetitive and stereotype behaviours? I've actually got a friend who has an autistic child and another child with ADHD, and it was really difficult when they were both quite young because what her younger child with ADHD really wanted to do in the morning before school was run round the block a few times. But she couldn't do that because her older autistic boy just wanted to stack his blocks. And she's sort of trying to get him off that while trying to get the other one in the car. So again, that can be extremely stressful for parents. It's nobody's fault. This is just children's particular neurodevelopmental profile that's making life difficult. And I think we've moved on a lot, actually. I think in the last 10 years, I think as a society, we are much, much better than when my children were small, actually trying to think about that in kids and think about what's going on for my child. You know, is there a way that I can actually modify the environment a little bit just to make it a bit easier? And this is a very common one. A child with ADHD might just repeatedly forget their school bag, their gym kit, their homework instructions. And it's not that they're being lazy. It's not that they're being careless. They just can't help it. They literally can't help it. And often what's very helpful for parents is to understand that and just give one instruction at a time. And all you know, that's the intervention, is just understanding what I call the child's make and model. Hyperactivity is just exhausting. You know, mea culpa. My poor parents. I've actually got a very early memory of looking between the bars of the cot. And when I look back, I was just bored out of my mind. I do actually remember that. You know, kids with ADHD are just instantly bored. They need you as a parent to be right on top of them all the time, and that is really exhausting. One of the things I think it's important to think about is that we tend to have less in the way of extended family support these days. I don't know how many of you are foster carers, but if you're a foster carer, it becomes very difficult because people need to be, you know, score checked and, you know, to actually get that support with your child from other adults is challenging. But actually that's the kind of usual human condition, is that we would usually spread the kind of burden of childcare across a little bit further across the community. And I think we've become pretty poor at that in our society. And you know, being kind of on 24/7 with a child who's hyperactive is very, very difficult for anyone. And for teachers at school and for the rest of the class, that can be a child who gets instantly bored and wants to just tap the back of the head. And of course, this becomes really challenging for children as well, because they get told off a lot. They start to feel shame. They start to get known for difficult behaviour. Before they know it, they're sitting in the front of the class. They're standing out. So it's very hard for their self-esteem as well. And it might just be very, very hard, very challenging for a restless, dreamy child to actually engage in the classroom. And again, they're often the ones that are very, very impaired. It's very hard for us to notice as adults that they're not really taking in the curriculum. And it may well be that they're perfectly capable of it, but they're just busy getting distracted by the football match that's happening out there. There isn't a football match happening out there. There was when I came in, and I had this image that you'd all be turning your chair around and facing away from me. So again, just to remember that If parents also have problems with learning and impulse control, language or social understanding, it's going to be even more challenging to actually make these modifications, for you and your child to really get to understand one another. So, really, fundamentally, life is more stressful for both children and parents if the child has a neurodevelopmental condition. And to be honest, except for really rare exceptions, all parents are doing their very best. In my whole decades of practice, I think I've only met 2 parents who really, really, really dislike their child. I've got a colleague who worked for many years purely with families where the parents had abused and neglected. That judge had said that the parents had abused and neglected their child. And she said the same. She said she's hardly ever encountered a parent who was actually sadistic in some way. Almost all parents, virtually all parents, are just trying to do their best. They're really trying to do their best. And gosh, we all muck up sometimes, but some might be caught in a vicious cycle and might really need additional help to get out of that. And if things are allowed to get worse, if we don't give support soon enough, then child abuse and neglect can occur at a population level. Child abuse and neglect of the severity that a child needs to come into the care system is actually quite rare. We just finished a study where it took us nearly 13 years to complete a study across Glasgow and London of children under the age of 5 in foster care, because actually, even though we were recruiting about half of all children in Glasgow that were coming into foster care, it just took a long time. And I think that's really important to remember that that level of abuse and neglect is not common at the population level. Oops. So how does it all happen in practice? So let's just imagine neurodivergent children, neurodivergent parents. The parents are really, really get the children. Things are going well. They're totally tolerant of the child's behaviours. The children are tolerant of their parents. The fact that their parent probably also forgets to remind them about the gym kit. They're all happily bumping along together in a virtuous cycle, getting to know each other as time goes on. But what happens if there's job loss, poverty, parental stress, divorce? What do children do when they're stressed? They act out. Children's behaviour deteriorates. They'll either act out or they'll withdraw and start to refuse help. And of course that makes parent stress even greater. So there you've got a vicious cycle. So there you are, you're in a vicious cycle, things are really difficult, family relationships are strained, and you're still trying to deal with the job loss and the mountain debts, and it can be really overwhelming for parents. But I think it's also really important to remember that doesn't have to be the stable state. You can get out of a vicious cycle. So imagine grandparents move into the area, start being able to babysit a bit more, parents get a chance to go out, sometimes have a bit of grown-up time. They start to feel a bit less stressed, the kids start to feel a bit less stressed. That vicious cycle could actually start to settle back into a virtuous cycle. So I think it's really important just to remember that even when things are very difficult and very strained and everybody's at each other's throats, that doesn't have to be the stable state. Things can change. So let's just get back as we start to come to a close to this issue about overdiagnosis of ADHD and autism. I haven't really talked about autism today particularly, but so I guess my personal view is that I think perhaps in some areas we're maybe sometimes diagnosing the wrong people. Very careful about saying that, because I think we need to be really reassuring that ADHD and autism are differences. They're not disorders, even though we talk about ADHD, attention deficit hyperactivity disorder. If you can have ADHD and be Emma Watson, then, is that a disorder? Is that a problem? That plenty of people out there who've got the impulsivity, the hyperactivity, they maybe struggle with concentration, but they're probably good at keeping lists, setting reminders on their phone. They're not actually impaired at all. And I think we probably should be careful not to be focusing all of our health service, on that. Because, I would hope that we can move toward a situation where we can actually maybe start to recognise these symptoms in ourselves. And if they're not causing a problem, we don't need to see a doctor about it. That would be a good state to get to. However, we must acknowledge that if children, adolescents and adults are suffering because of the neurodivergence, then really I think pretty urgently we need to be trying to help. And it might not be if we get in early, it doesn't have to be complicated. So we should be trying to modify the environment, trying to support their families. And this would probably reduce everybody's anxiety and actually reduce the onset of mental illness like depression, anxiety, psychosis, that kind of thing. Reduce family stress, reduce the prevalence of child abuse and neglect, improve the health of the population. Now, we're also interested, I know, particularly in this group, thinking about digital media. Does digital media use cause ADHD? Well, there's some suggestions that a higher frequency of digital media use and subsequent symptoms of ADHD might be a thing. But this group, Thorell and colleagues, they did a more recent systematic review where they pulled together 28 studies. And what they concluded was that children with ADHD symptoms appear more vulnerable to developing higher problematic use of digital media. And then problematic use of digital media might actually make their symptoms worse. So it might not be that digital media is causing ADHD, it's just that, well, look at me. Now that's me. I spend a lot of time plugged into digital media. I just got my colleague to take a picture of my office. Look at all the papers. And do you know, one of the things that you get with ADHD is hyperfocus. You get really plugged into something. You get really stuck on what you're doing. That's great for an academic. You just got to remember to get up and do your stretches every now and again. And I think probably, I'm the kind of person where I know my make and model, and I make sure I do my Pilates in the morning. I make sure I put an alarm on for 25 minutes if I'm writing, and get up and stretch and walk around the building. But we do need to help our children with this. We need to support them not to get so plugged in. And of course, unfortunately, the tech companies are not helping with that because they deliberately build in algorithms to get children addicted and get them keeping on. I think one of the things we can really do is be open with our children and adolescents about this. My son has ADHD, and he actually worked out for himself that he needed to turn, back then it was Facebook, he's in his early 20s now, but when he was 14, he worked out that he needed to turn Facebook off for 4 hours in the afternoon because he said, for me, it's just like being in a party the whole time. Too stimulating. And I think we can have conversations with our children about is this helping you? And then I also think that there's a lot of positives to be got from digital media. And this is something that I sat on a grant panel, where we judge grant applications really across the health sciences, particularly kind of new innovations. And there's a lot of new grant applications coming in for scientists wanting to look at digital innovations to help with ADHD, actually. And there's a review that they suggested that positive outcomes that there are some positive outcomes from interventions using telehealth, the web, extra gaming, for example. We worry about kids with ADHD actually not getting enough exercise when they're just plugged into their Minecraft or whatever. But what about getting them up, using their Wii tennis or whatever it is? And then there's also a lot of exciting developments in terms of tools that are there to help decision making for clinicians, hopefully to actually reduce our waiting lists. So I think just to really summarise, ADHD traits are common in the population. We reckon, actually, I didn't say how common, but we think sort of 5 to 7% of children probably have ADHD traits. They're not necessarily problematic, but when they're problematic, they do need to be addressed and treated early, because if not, they are associated with a whole host of negative outcomes that could be avoided. It's missed opportunities if we don't get in there and treat. We're thinking about digital technologies. People with ADHD probably are vulnerable to overusing digital technologies. And then overuse might be making ADHD symptoms worse. So can we actually flip our relationship with digital technologies and get them helping us? There's been some really interesting recent innovations that are starting to develop using kind of serious games. They call them serious games that are hopefully just as addictive for people with ADHD, but are actually helping their symptoms at the same time. So that's an interesting avenue that we can think about. And that's really all I wanted to say, and I'm just hoping that we can use the rest of the time now for a bit of discussion